When we talk about having a healthy pregnancy, we almost always focus on the mom's health, her diet, her sleep, her prenatal vitamin, her stress levels. And mom's health is extremely important. But here's what a lot of people are not talking about yet. Dad's health before conception may impact pregnancy outcomes, birth outcomes, and even mom's health throughout the pregnancy. And I have a research study here to show it. I'm Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist helping people build families for over 20 years. I love educating. I'm so glad you found this video. If this is your first time to the channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. And if you're coming back because you found a previous video helpful and valuable, welcome back. I'm so glad you are here. There are two other ways to stay in touch and learn. You can sign up for my weekly newsletter in the description below, and you can listen to my podcast, the Brave and Curious podcast, anywhere you listen to podcasts, reproductive health, interviews, overall wellness, and video interviews here on YouTube, Brave and Curious podcast. Today, we are talking about a health risk in pregnancy that a lot of people don't know about yet. Dad's health. There's an incredible study out of Stanford that really looked at independently the father's health pre-conception and its impact on the pregnancy and the mom's health through the pregnancy. Today, we're going to cover four main topics. Topic number one, the study. Who did the study? What were they looking for? How did they study it? Topic number two, what are the findings? What are the results of the study? And what did we learn from this study? Topic number three, tips for future dads. Habits to break and habits to start when you are trying to conceive. And stick around to the end of the video or I'll give you topics and questions to ask your doctor for your personal situation. Topic number one, let's talk about this study. The title is Association of Preconception Paternal Health on Perinatal Outcomes, Analysis of U.S. Claims Data. The lead author is Dr. Kassman. It was a group of doctors out of Stanford, specialists from obstetrics and gynecology, urology, and pediatrics. The researchers looked at almost 800,000 singleton live births in the United States between 2009 and 2016. They used large insurance claims database that linked fathers, mothers, and babies together, which is actually quite rare in research, at least in the United States, because we usually only have data on the mom and the baby. Having the father's health information, especially before pregnancy, is a really unique way to look at overall health in pregnancy and even mom's health during the pregnancy. They examined the health of the fathers for a year before conception and asked the question, do dads with certain health conditions have different pregnancy and birth outcomes compared to dads that are healthier? The conditions that they looked at included metabolic syndrome, and this is a collection of issues that can often run together, including hypertension, high cholesterol, diabetes, and obesity. Independently, they also looked at COPD, which is a lung disease, cancer, and depression. The outcomes that they examined included preterm birth, low birth weight, NICU admission, gestational diabetes in the mother, preeclampsia in the mother, eclampsia in the mother. That is a seizure associated with the high blood pressure or preeclampsia of pregnancy, and the length of maternal hospital stay after delivery. Topic number two, what did they find? Let me walk you through the key findings of this paper, and let me be clear that results were adjusted for maternal health issues. This means that the researchers accounted for statistically the mother's own health conditions, so associations of paternal health are independent of what's going on with the mother. There are four main findings in this paper. Finding number one, paternal or dad having metabolic syndrome increased the risk of preterm birth. Fathers who had most or all components of metabolic syndrome, remember that's hypertension, high cholesterol, diabetes, and obesity, had a 19% higher odds of having a baby born before 37 weeks gestation. That's preterm. And this relationship was dose dependent. So the more factors of metabolic syndrome that the father had, the higher the risk of preterm birth. So if a father had both high blood pressure and diabetes, there was a higher risk of the baby being born preterm than if the father just had hypertension. That dose response or higher risk with more and more components strengthens the findings of the study. Finding number 2, low birth weight and NICU admission. The study showed that fathers that had most or all components of metabolic syndrome had a 23% higher odds of having a low birth weight baby and a 28% higher odds of their baby needing NICU admission after delivery. Think about what a NICU stay means for a family. The emotional toll, time away from home, increased costs. If people could learn that their health before conception could decrease the risk of a NICU admission or having a lower chance of having a preterm baby, this could really be impactful. Finding number 3, individual conditions also mattered for increase in preterm birth. So it's not just the dads that had this metabolic syndrome and all of these conditions layered together. The risk of preterm birth was different for individual conditions. Hypertension in dad, 11% higher odds of preterm birth. Diabetes in dad, 8% higher odds. Obesity only in dad, 13% higher odds. And depression in dad, 19% higher odds of preterm birth, 21% higher odds of a NICU stay. The depression finding is really interesting and unique, and it's not something that has been discussed a lot about. You don't usually think about focusing on mental health as being a part of the overall wellness of a pregnancy, and especially mental health in dad impacting health of the pregnancy and health of mom. Finding number 4, the mother's health during pregnancy was impacted by dad's health before pregnancy. Now, these findings in the study surprised me the most. I was just shocked that mom's pregnancy experience could be impacted by dad's health. If moms had the partners had components of the metabolic syndrome, so remember that's hypertension, high cholesterol, diabetes, and obesity, moms had higher risks in pregnancy, including a 30% higher odds of gestational diabetes, 31% higher odds of preeclampsia, and longer hospital stays after delivery. Remember, preeclampsia is hypertension after 20 weeks of pregnancy associated with other organ issues, issues with the liver, with the kidneys, etc., and it's really quite serious. So let that sink in. The father's health before pregnancy can impact not only how the baby is born and the health of the baby, but the mom's health through pregnancy, which can even be associated with later health risks in life. This is revolutionary for me. This is definitely not something that I learned in medical school. And for millennia, like anything that has to do with getting pregnant, miscarriage, health of the pregnancy is always the woman's burden. And I just feel like it's incredible. I get it. I can understand it on a scientific level, but just to have the ability to share this study and share this concept, and to share just how important it is for both partners to be healthy, that getting pregnant is a team sport. I want it to be really empowering. I want it to be exciting, and I want both partners to be aware of this. And it's interesting because the authors really do go into the discussion about why they think this could be. Not only are they seeing this association, and it's really quite interesting, but also like how could it work scientifically, medically? And they focus on 3 things: epigenetics, the placenta, and shared lifestyle. Let me explain. Epigenetics as a term means like surrounding the DNA. So we're born with the same stacks of genes and DNA that we're always going to be born with, but not all of our DNA gets expressed. Poor diet, obesity, hypertension, poor lifestyle changes, poor habits can really impact how the DNA is being read and how cells are functioning within our body, including sperm cells. What's really good to know, though, is that sperm is made every 3 months. And so although those stem cells are staying the same, and new mutations can happen in stem cells over time, there really is a chance that focusing on nutrition and health could change and empower and hopefully improve the health of the pregnancy and mom's health through the pregnancy. Second, the sperm is really important for the function and formation of the placenta. And the placenta is extremely important in getting nutrients and oxygen and health to the baby. And preeclampsia is thought to be a placental issue. Low birth weight with the baby is thought to be a placental dysfunction. And so understanding that sperm is so important just on that really basic level of the forming of the placenta and how the placenta and the uterus are interacting, that really does make sense that healthier sperm is going to have a healthier placenta and have a healthier pregnancy. Third, shared lifestyle. So although the authors tried statistically to really isolate mom's health away from a factor to influence the association between paternal health and baby outcome and pregnancy outcome, it could be that two people living together have a shared lifestyle. And of course, if dad has poor health and poor lifestyle, there's a chance that mom's poor health and poor lifestyle could be impacting the pregnancy and the health of the baby. Of course, this is all interrelated. And no matter how much statistics you do, there's going to be some things that you just can't tease apart. Topic number 3, what can you do about this information? Okay, now you've got this eureka moment. Dad's health really matters. Okay, what can dad do about this as you're trying to conceive to improve the health of the pregnancy, improve mom's experience and health through pregnancy as well? I wanted to focus on habits you could reduce and then habits you could improve. So as far as things to cut out or really minimize, I've got 7 things to think about. Number 1, excessive weight is part of this poor metabolic health. So obesity can be associated with poor sperm counts, poor sperm function, increased DNA fragmentation in sperm, higher risk of miscarriage, lower testosterone, higher estrogen, more infertility. People can be healthy at different weights, but getting to a healthy weight in a healthy way for you could be a step in the right direction. Number 2, processed foods in the Western diet. The Western diet is full of ultra-processed foods, extra sugar, refined carbohydrates, and a lot of unhealthy components. So trying to get towards a nutrition and diet with more whole foods. Mediterranean diet has been associated with increased fertility and lower miscarriage rates. Mediterranean diet just means lots of fresh fruits and vegetables and some animal protein, but less red meat, more fish and poultry. So thinking about your nutrition in a positive way. Number 3, smoking and vaping out. So tobacco, cigarettes, smoking, vaping been associated with poor sperm function, increased DNA fragmentation, infertility, increased risk of miscarriage. This is a habit you can cut out. Number 4, heavy alcohol consumption. I know alcohol is a part of our social fabric, but daily partaking of alcohol and in excessive quantities is not good for our health, including our reproductive health. Heavy drinking is associated with lower testosterone, reduced sperm quantity and quality, and hormonal disruption. So minimizing or eliminating alcohol as you're getting ready to conceive is a great option. Chronic unmanaged stress. Stress matters. We can't eliminate stress, but we can work on ways to manage it. Paternal stress and psychological factors can alter sperm epigenetic profiles. Depression in fathers was associated with one of the largest increased risk of preterm birth. I want this to be empowering. I want you to find ways to recognize and manage stress, whatever is right for you. Of course, finding a medical professional is important, especially if medication is needed. Finding therapy can be extremely important and wonderful, but it's also finding ways just to reset your nervous system, whether it's getting outside and hiking, spending time with friends that bring you joy, reading, quiet time, whatever that is. But don't be afraid to seek help and find a medical professional to help you. Just can't emphasize enough, and I'm so glad that we're finally talking about this. Number 6, heat exposure. So I have lots of videos here on male factor fertility and ways to improve sperm counts and sperm production. And one of the things that can be really harmful is heat and testicles, specifically hot tub use more than 3 times a week has been shown in multiple studies, also out of Stanford, to affect sperm parameters. So think about the heat exposure. And finally, number 7, testosterone. Exogenous testosterone will shut down sperm production. And a lot of people don't know this. So some supplements that are saying they're boosting your testosterone, you have to be really careful because they might actually have testosterone in them. Actually taking exogenous testosterone, even if a healthcare provider suggests it, some healthcare providers are not aware that it can actually decrease sperm production. It's like giving a man a birth control pill that shuts down ovulation in women. Testosterone shuts down sperm production in men. So do not take exogenous testosterone. If you are taking testosterone and you're planning to get pregnant, talk to your doctor about how to manage reducing it in a way that will avoid like a real testosterone crash. Just talk to your doctor about it. Now, moving to things that you can do or add to your health regimen to improve your health and improve the pregnancy outcomes. Number one, get a health checkup. When is the last time you saw a doctor? Get your blood pressure checked, get some basic blood work. Make sure you don't have diabetes or this metabolic syndrome. Just get a checkup. Number two, optimize your diet. Number three, move your body consistently. This doesn't mean you have to go join a gym and exercise with intensity every single day, but consistent moving of your body and exercising is helpful for not only your physical health, but your mental health. Number four, prioritize sleep. Sleep is essential. It helps our hormone health, helps our sperm production, our reproductive, our immune health. Sleep is important. Finding a routine and a quiet place, trying to go to bed at the same time and waking up at the same time is one of the best things that you can do. And if you are snoring, if your partner is telling you that you are stopping breathing in the middle of the night, you could have sleep apnea, and sleep apnea can absolutely impact your reproductive and immune health, and you should get a sleep study. 5, address mental health proactively. Number 6, consider a semen analysis. It's never too soon to get a checkup. You cannot assume because you've caused a pregnancy in the past that you currently have a normal semen analysis, and it's a wonderful checkup to just make sure things are okay. All right, let's wrap this up. Let me bring this home. This is a revolutionary study. It is fascinating to look at almost 800,000 births and compare health of mom and health of baby for a year before conception to find that paternal health before conception impacts not only the health of the pregnancy, the health of the baby, but the mom's experience and health through pregnancy. I want this message to be empowering. I want both partners to realize that this is a team sport and that taking lifestyle actions, thinking about diet, exercise, mental health, overall wellness is one of the best things that you can do before you even get pregnant to try and ensure that you have a healthy pregnancy. Now listen, there are some things that we are not in control of. So I also don't want people to take away from this video that if they did have preeclampsia, that it was somehow, their fault. I want this to be an empowering message, and I want you to learn from this. Share this video with someone that you know would be interested in it. This is such an interesting topic. I'm glad you stuck around to the end. A couple of pointers as you are talking to your doctor, as you're trying to conceive, or before you're starting to try to conceive. Number one, both partners should get a health checkup. Make sure you review medications, make sure you get kind of basic blood work, look for high blood pressure, look for diabetes. And if you have chronic illnesses, optimize them as you're trying or before you conceive. If you're taking testosterone before you're trying to conceive, talk to a doctor about how to wean off the testosterone and other medications that you can take to boost sperm counts as you're trying to conceive. And think about lifestyle optimization. We talked about nutrition, sleep, exercise, stress management. Think about mental health for both partners, overall well-being for both partners, to have the healthiest pregnancy for both partners that you can. I hope you found this video informational, educational, and valuable. I think this is revolutionary information. I love it. I love for both partners to be involved in the health of the pregnancy. Like this video if you learned something, comment with questions that you have. Be sure and share this video with a friend that you think is going to find this information valuable. And until next week, stay brave and curious.